Hi everyone, welcome to our instructional video on how to insert a laryngeal mask airway, commonly known as LMA. This device is crucial for maintaining a patient's airway during anesthesia or in emergency situation, and today we will walk you through the steps to ensure a safe and effective insertion. So friends, this is fifth video in our basic life support series, BLS series, and I hope you have already watched the previous episodes. If not, do watch them now to have a better perspective. Friends, the LMA, it's a supraglottic airway device. Basically, you block the esophagus and ventilate the trachea, used to keep the airway open, and it is typically used in patients who require short-term ventilation during anesthesia or in emergency situation where intubation is not feasible. And I must emphasize to everybody who is watching this video that every medical student, every paramedical staff should be well aware of this device and technique, because proper insertion is very easy and it can save the life. So what are the indication and contraindication for LMA? The LMA, as I said, indication will be short surgical procedures, difficult intubation scenarios, and cardiac arrest where intubation is not immediately possible. And in such kind of emergency situation, LMA can be a very helpful tool. The contraindication will be when the stomach is full. In elective situation, there is a high risk of aspiration, then LMA is not advisable. When there is severe gastroesophageal reflux or the GERD, or there is upper airway obstruction, like in the case of severe facial trauma, the LMA will not be effective method in that case. As discussed in the nasopharyngeal airway, either it is a NPA or it can be a endotracheal tube. So let's understand the basic anatomy. How does it work? So basically, as shown in this picture, the esophagus is the posterior most structure. In front of esophagus is trachea, and this posterior 1/3 is the membranous part where basically the esophagus has a space to expand. So posterior most is esophagus, then trachea, then this epiglottis as shown here. It covers the basically trachea whenever we are eating, so the base of tongues moves backward, the epiglottis covers the trachea, and the food of bolus is directed towards the esophagus. Oh, that is the whole mechanism. So whenever we are securing the airway with the endotracheal tube, so we have to insert the endotracheal tube just behind the epiglottis into the trachea. But in emergency situations, when you are not doing it regularly, then usually the trachea, this endotracheal tube will go into the esophagus, and then the whole problem will start. So this laryngeal mask airway, it is beautifully designed cone shaped structure. When inserted properly, it will block the esophageal opening, and through the opening in front of this laryngeal mask airway, the air will enter into the trachea. So simple device, very effective method. So how to choose the correct size of the LMA? The LMA comes in different sizes from 1 to 5. So basically number 3 is 30 to 50 kg weight, number 4 is 50 to 70 kg weight, and number 5 is more than 70 kg, and 1 and 2 are basically for the children and the infants. So you have to remember the basic general thumb rule is, whenever you are not sure in adult, use the number 4. It will cover most of the patients. How to prepare the laryngeal mask airway? First, you have to inspect the device that there is no damage. You have to inflate this balloon as being demonstrated here in this video. Then you lubricate the laryngeal mask airway with the Cholecystectomy jelly or any water-based jelly. The Cholecystectomy jelly is most commonly available in the hospital setting. Then you deflate it completely and you insert gently. So all these steps are being demonstrated here in this video. So usually number 4 size LMA, as I said, and the capacity of the balloon is written over the device, but the number 4 size, the capacity of balloon is 30 ml. You aspirate 30 ml of air in 50 ml syringe. Then you insert into this basically cap, properly engage the cap, then inflate it. The security balloon with the cap should be under this tension. That means you have generated enough air. Then deflate, and while deflating you give a shape to the LMA. You basically try to invert or to give a shape so that it fits beautifully. And as I said in all my videos on basic life support, whenever we are dealing with these type of situations, or you are helping a trauma victim or in hospital setting, always remember to activate the emergency response team or call the 911 or the 108 wherever you are working, so that the expert help available to you. And always sort for the help that here is an unconscious patient or is a trauma victim and he or she needs help. Somebody helps me. Somebody please help me. For inserting the LMA, you have already lubricated, checked the basically this valve mechanism and everything is okay. Then deflated, lubricated, and then you basically position the patient. So you have to tilt the head back, push the forehead back, and lift the chin up. So head tilt and chin lift. This is the position that will open the airway. Then hold the LMA like the pen holding position, and your index finger is at the junction of mask and tube, as we will demonstrate in the video. So that will be a proper that will help in the proper insertion. After positioning the head, now you insert the LMA. As I said, hold it like a pen and your index finger is at the junction of this valve and the tube. Then you slide the LMA along the hard palate. The palate is basically the upper part of the mouth. So inside, slide it, follow the curve and advance until you feel the resistance, and you have to slightly push gently so that the tip of this LMA will seal the this esophageal opening and the air will enter into the trachea. If you feel there is too much resistance and it's not going properly, then you can basically retry it. Reinsert it, check the correct size, follow the curve, position the head properly, head tilt, you push the forehead back, lift the chin back so that the neck is basically in extension. That will help to open the airway. Then you, after it is secured in the position, you push with the you push this 30 ml air. Check that the security balloon along with the security plug is properly in turgid condition, and then you start ventilating the patient. And with every ventilation you should be able to see the rise in the chest. That means your LMA, laryngeal mask airway, is in proper position. And do remember to secure the LMA with the help of tapes or with the help of this some sort of gauze, and you tie it around and wrap it around the head, or with the help of tape, elastoplast. And then don't overinflate the valve. 30 ml is a recommended air for number size 4, as overinflation can cause trauma. So the troubleshooting part I have already covered. Reassess patient head position, deflate the cup, try reinsertion, use proper finger technique, and consider using a different size LMA if problem persists, or alternative airway management like emergency tracheostomy, or it can be an endotracheal tube first, or there can be nasopharyngeal airway, which we have already covered, Goodall airway, or the emergency tracheostomy. So now we will run the whole sequence in a continuous mode. So first you assess the patency of the laryngeal mask airway, that the valve is properly functioning, the seal of the air is maintained, and it is holding the pressure. 30 ml air is injected. Deflate it and give a shape. Try to invert it. Then lubricate this LMA properly, and the size is number 4 for 50 to 70. As I said, always activate the emergency response team 911 108 wherever you are working, so that the expert team reaches to you in time. And always seek for the help, shout for the help, that somebody help me, here is a patient who will need help, because it is difficult to handle such a situation single-handedly. Then after deflating, you insert this laryngeal mask airway following the curve of the hard palate. Give proper position, head tilt, chin lift, extend the neck basically. That will open the airway and reduce the pressure on the trachea. Cone of the laryngeal mask airway will block this thing, and here in this basically snapshot, I'm showing the proper finger technique, that this is the technique to insert the this laryngeal mask airway. If there is a problem, then retry, reposition, or check the size. Then once it's inside the this thing, start ventilating, inflate the basically this air seal first. 30 ml of air is injected, and then you secure this laryngeal mask airway, which we have not shown here in this video. You apply a basically loop of a tape or some kind of a bandage, and you tie it around the head, or you secure it with the help of adhesive tapes. Once it is inflated, then you start ventilating, and with every ventilation you should see a visible rise in the chest. If not, then your laryngeal mask airway is not in position. Then reassess, reposition. So my dear friends, in every emergency, the skill you master today could save a life tomorrow. Keep learning and stay prepared. And these videos can be of help in emergency situation also. I'll give a highlighted timeline also. And also these videos I'll upload in our on our app also as a free videos, because in the mumbo jumbo of YouTube, sometimes it is difficult to locate the proper video in at time of the emergency or urgency. So do download our app, and that can act as a basically pocket guide for you guys. So thank you very much, friends. I hope I was able to add some new insight to your knowledge, and this video may save somebody's precious life at some point of time. Thank you very much. Happy learning.